A new program in BC is teaching high school students about endometriosis. It's a condition that affects 1 in 10 women, and a lot of women suffer for years before finally getting treatment. Joining us this morning is Dr. Prati Sharma from Create Fertility Centre. Good to have you with us again.
Thanks so much, Anne-Marie. It's always great being back on the show.
For people who aren't familiar with it, what is endometriosis?
So endometriosis, as you said, is a very common reproductive condition. It affects 1 in 10 young women. It's probably a condition I see in my office 3 to 4 times a day. The definition of endometriosis is displacement of endometrial tissue. So endometrial tissue is the tissue that's normally found in your uterus that sloughs off during a normal menstrual cycle. But in women with endometriosis, this tissue is displaced and it sticks all over the abdomen and pelvis. And that tissue is responsible for creating the symptoms of pain, painful intercourse, infertility, and all of the common symptoms that patients report when they come into my office.
I am one of those women who didn't realize that I was living with endometriosis until I was trying to have children. And that's when we had the diagnosis. But when I went through some of the symptoms, even others than what you were mentioning, I was like, well, if someone had told me this, I've been having all these symptoms since I was 16.
Right, and so that's why I think it's so important for women to identify these symptoms early and have early intervention, early treatment, and take charge of their own reproductive health.
Which is why I love that it's being taught to high school students. More than 60% of women have had their symptoms dismissed by a health professional. But what do women need to know about paying attention to their own bodies? What signs are they watching for?
Yeah, I mean, I think that women are just becoming more and more savvy and getting to know their bodies. And so anything that's out of proportion to what you would expect to be normal. Now, pain is a very subjective symptom, but I think, you know, women know their bodies. And so if you feel like the pain is out of proportion to what you would normally affect, or if it's something that's bothering you to the extent that you have to take days off from work, or you're taking pain medication every month, it's really important to see your primary care provider and start the evaluation and perhaps even get referred to a specialist like myself, a reproductive endocrinologist, that could do a deeper evaluation and see what's going on.
This program in BC is a pilot project. It's put on by the BC Women's Hospital. Would you like to see this in hospital or in high schools, rather, right across the country?
Absolutely. I think education and early intervention are so important. And for women in their teens and 20s to learn about these disorders and identify symptoms early on would be great, because there are treatments that you could start early on that can mitigate the symptoms and help the condition, so that later on when you're dealing with things like having children, the signs and symptoms are less and you might actually be in better shape to conceive. Endometriosis
is just one of a range of topics that just aren't often talked about when it comes to women's health. Anything around menstrual cycles for a long time, you know, was never really discussed. Are there other conditions that you would like to see brought to the forefront?
Yes. Another condition that's very similar to endometriosis in terms of its incidence is polycystic ovary syndrome. Again, it affects probably about 10 to 15% of young reproductive age women. Common symptoms include irregular cycles, signs of high male hormones like acne and facial hair.
Body hair as well is another symptom.
Exactly. And again, same thing. You know, lots of people poo-poo these symptoms saying, oh, it's just getting your cycles into shape, you're a teenager and whatnot, but they can really affect women's sort of mental health and their daily activities and how they feel about themselves. So again, these are symptoms that you can identify early on, see your primary care provider, see a reproductive endocrinologist, and get an evaluation and diagnosis sooner.
They can also be systemic because women will often check in with other women. So if you're checking in with your mom, for example, and she doesn't know about her own body health or any of these conditions, she'll just say, well, that's what my periods were like too.
Sure. But it's interesting because if your mother suffered from PCOS or endometriosis, or your sister, that can be a clue that you might also have the same condition.
Great.
So take that family history seriously.
Great information to have. Thanks for coming in today.
No problem. Thanks again.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.